There,
Oh,
there we go.
finally. I kept on pushing accept and it wasn't going. How are
Uh,
you doing?
I'm great, man. Can you hear me?
Yeah, yeah.
Excellent. Thanks for hosting.
Thank you. Thank you. Thanks for joining me.
Yeah, no, of
So,
course.
how did you get into, go ahead and tell a little about yourself. We can go in any direction that you like.
Sure.
How did you get into being a cannabis doctor?
Um, so it's a long story, but basically, I come from a family of doctors. My dad's a big doctor in the neurology field. My mom is a big nurse, um, and I come from a huge family. So there's 6 of us, if you can believe it. I'm the baby, and everybody else picked a different job. So doctor was the only job left. I scooped that one up, and I was a family. I am a family doctor. You know, I did primary care because the country needed primary care doctors, you know, when I finished medical school. And it was really honestly the people in front of me, the patients that I was seeing that turned me on to the need for information and guidance in cannabis. Like there was a clear need, everybody was using it. And I was open-minded enough to hear it. And I think sometimes doctors, you know, aren't so open-minded. But I heard patients wanting more information about it, and I wanted more information too, because everything I saw was, you know, scattered. I mean, it was just crickets. I mean, there's nothing useful in the normal medical world about cannabis, and that's mostly I learned because doctors aren't reading it. You know, like it's not that there's no information out there; it's just nobody's reading the research. I mean, we've all heard, oh, we don't know anything, we can't use cannabis because there's no research behind it, and it's just complete baloney.
Yeah.
You believe it or not, you know, what do I call you? Should I call you Steve, Jedi, Steve, Bob?
That's good.
All
That's good.
that's good. Okay, I like Jedi. I'll call you the Jedi.
Okay.
So you know, the information's out there, but nobody's reading it. And there's 10 times more information about cannabis than there is about the common cold or Lyme disease. I mean,
Wow.
just imagine that. Like so much. There's so much information out there. It's just nobody's reading it. You know, that's the catastrophe.
Yeah, it's a lot of times doctors are so busy. From what I've heard, doctors are so busy after medical school, after doing the residency, and they just get in a place that they're kind of stuck in a paradigm of where they were when they were going through it. I mean, my dad was a doctor, and he called psychology quackery for like the
No kidding.
longest period of time.
No kidding.
Yeah. And I know like some psychology is quackery, but he just called it all that in general, and that was just the fact of how old he was. I mean, he was born in 1929, so I don't know what year he was going to medical school, but that was just like the fact of when he was going, the fact that of where it was at the time. And I think being a corpsman in Vietnam, he could have benefit from a little psychology.
Yeah, no doubt. I mean, imagine like your dad was actually pretty common. Like, you know, back in the day, physical stuff, physical illness, physical issues was pain. That was suffering. Like if you had mental concerns or psychological concerns, it was totally stigmatized. You know, you were crazy. You put you in a nut house. Like, you know, throw away the key. That's what our current culture has kind of grown up in. Those are the parents that we all kind of knew, you know, grew up in that age. It's really it's scary how far we've come, and thank God, you know, like where people who are really suffering in a lot of different ways can still get help.
So you said you're a family doctor. What is your age range of people that you work with?
Everybody. So now, I mean, as a family doc, I saw everybody. I mean, I'm a pediatrician. I also am a geriatrician, so I see all the newborns. I would deliver women. You know, I'm an OB-GYN as well. I have the great fortune not only of delivering whatever a couple thousand women in the hospital, but I've actually delivered all 4 of my own kids. So I live it. It's a dream come true for me. But in cannabis now, I see the same range. You know, this is my bread and butter. I'm comfortable with kids. I have a whole pediatrics clinic here in Massachusetts, where we see our youngest is 6 months old, and our oldest is 104. It's literally everybody. Anybody who's curious about cannabis, wants to learn about it, wants to explore how it might help them, my door's open.
Awesome, awesome. So you said like you've totally walked away from any pharmaceutical type products?
No,
Okay.
not at all.
I misread
I don't.
one of your little quotes.
Yeah, no, that was so. No, you read it correctly.
Yeah, yeah.
What I've been trying to do lately in the last couple months is blast patient reports, all the quotes that I'm hearing. I'm trying to bring everybody who's interested into my office space and just hear the magic that I'm hearing, because I think honestly, there's only so much that doctors and scientists and researchers can talk at people. I think sometimes you have to hear it from your fellow man and woman.
Yeah, yeah. I agree.
So I'm trying to do that. I'm actually, I'm working on putting together my own podcast around that, where we're going to interview regular people about their experience with cannabis, all the good stuff, all the bad stuff, just throw it out there. I mean, there's so much to learn for everybody. And there's still people who are scared about it, like we've only just begun.
I think that's where a lot of the doctors, non-doctors, people that are pushing through any type of alternative medicine, where they get into trouble is when they try to talk too much, opposed to and I feel like we as consumers can talk about our experience a lot more freely.
Yeah.
Um,
I think, I mean, maybe what you mean, and don't let me put words in your mouth, but is talk sort of out of school, like talk not only things that are meaningful to them, but also sort of blur the lines of what's useful and what's true.
yeah, for sure.
Yeah, no, I've seen that. Of course, we all have. I mean, that was the issue in politics over the last, whatever, 5-10 years, that people can say whatever they want. I mean, social media is a platform for people now, and as long as you have enough likes, comments, you get vaulted out, no matter how silly what you're saying is or how truthful.
So and I've heard it this way, and I want to get your opinion on it. Does the Hippocratic Oath mean that when a patient says something that doctors do have to research it? Is it their Hippocratic Oath to research cannabis if somebody says it?
Not
Or
really.
is that
Okay. Well, the Hippocratic Oath is just it's an informal oath, which is just a promise to care about people meaningfully. To not do harm, to not treat people with things that could hurt them, but also to not. And this is where sort of that word gets involved. If cannabis can help people, and you're not embracing it, if you're not learning about it, you're not offering it to patients, I think there's a pretty solid argument to be made that that's not the most ethical practice of medicine. And that's a weird, that's a weird line, and it's shocking, and it's a little bit harsh. And there's a fair comeback. And the fair comeback is, well, what about the research? And I'm not talking about the research we were talking about before.
Yeah.
There is paper research on animals and in lab. There isn't as much research on humans and how the long-term effects of cannabis impact human life. And it is fair for doctors to say, look, I know so much more about pharmaceutical medicine, about regular therapeutic medicine. I don't know as much about how cannabis impacts people in the long term. I don't feel comfortable. I mean, they can say that. I get that they don't feel comfortable recommending it because they don't know as much. And that's totally legit. And honestly, I don't want doctors like that recommending or talking about cannabis. If they don't know it, if it's not a specialty for them, just like I don't want Sally down the road who smokes a lot of weed, she shouldn't be given medical advice either.
Yeah, for sure. Agree, 100%. That's Sally. She's always trying to do stuff.
Fucking Sally, right?